general anatomy, including embryology and histology. Question number 1. The facial nerve stimulation during the testing of nerve is indicated by the contraction of which muscle? Temporalis muscle, masseter muscle, sternocleidomastoid muscle, or the orbicularis oris muscle? Answer is D, orbicularis oris. It is a facial muscle. All facial muscles, they are supplied by facial nerve. Temporalis and masseter are supplied by mandibular nerve. Sternocleidomastoid is supplied by spinal accessory nerve. Next question. Second, which muscles make up pterygomandibular raphe? A. Masseter anteriorly and palatopharyngeus posteriorly. B. Masseter anteriorly, medial pterygoid posteriorly. C. Buccinator anteriorly and superior constrictor posteriorly. Or D. Buccinator anteriorly and medial constrictor posteriorly. Answer is C. The pterygomandibular raphe or the ligament, it's a tendinous band of buccopharyngeal fascia that is attached by one extremity to the hamulus of the medial pterygoid plate and the other to the posterior end of your mylohyoid line of the mandible. Its posterior border gives attachment to the superior pharyngeal constrictor muscle. Its anterior border attaches to the posterior edge of the buccinator. Coming to the next question. The most commonly fractured bone of the face is which one? Zygomatic, maxillary, frontal, or nasal? Correct answer is D, nasal. Next question 4. Inferiorly, the nasal bone is attached to A. Frontal bone, B. Nasal bone of the opposite side, C. Maxillary bone of the frontal process, or D. None of the above. Answer is none of the above. Why? Articulations of nasal bone are as follows. Anteriorly with the nasal bone of the opposite side, posteriorly with the frontal process of the maxilla, superiorly with the frontal bone, and inferiorly with the upper nasal cartilage. Next question, number 5. The lesser palatine foramen, where does it lie? A. Lie in front of the greater palatine foramen and perforates the horizontal process of the palatine bone. B. Lie in front of the greater palatine foramen and perforates the pyramidal process of the palatine bone. C. Lie behind the greater palatine foramen and perforates the pyramidal process of the palatine bone. Or D. Lie behind greater palatine foramen and perforates the horizontal process of the palatine bone. The correct answer is C. It lies behind greater palatine foramen and perforates the pyramidal process of palatine bone. They are 2, 1 or 3 in number on each side. Coming to the question number 6. Which border of the lateral pterygoid plate is free? Medial, lateral, posterior, or none of the above? The answer is C. The pterygoid process projects from the junction of the greater wing and the body of the sphenoid behind the third molar tooth. Inferiorly divides into the lateral and medial pterygoid plate, which are fused together anteriorly and are separated posteriorly, thus having a free posterior border. The lower part of the medial pterygoid plate is prolonged, downwards and laterally forming the pterygoid hamulus. The lateral pterygoid plates are directed outwards and backwards. Very important. Remember these points. Question number 7. The muscle involved in whistling and pursing test of the mouth. A. Buccinator, B. Rhizorius, C. Orbicularis, or D. All of the above. The answer is C. For examination of facial muscles, following tests are performed. For frontalis muscle, ask the patient to look upwards without moving the head and look for the normal wrinkles on the forehead. For corrugator supercilii, frowning and making vertical wrinkles on the forehead. For orbicularis oculi, closing the eyes tightly. For orbicularis oris, whistling and pursing of the mouth. That's the question. Dilator of the mouth, showing the teeth. Buccinator, puffing of mouth and then blowing forcibly. For platysma, forcibly pulling the angles of the mouth downwards, forming the vertical wrinkles on the neck. Coming to the next question. 8. At birth, the mental foramen is present A. below the sockets of the two deciduous molar teeth near the lower border, B. below the sockets of the two deciduous molar teeth near the upper border, C. below the sockets of the canine and the first deciduous molar teeth near the lower border, or D. below the sockets of the canine and the first deciduous molar teeth near the upper border. The correct answer is A. In infants and children, the two halves of your mandible fuse during the first year of the life. Below the sockets of the two deciduous molar teeth near the lower border, the foramen and the mandibular canal, they gradually shift upwards. The angle of the mandible is obtuse, 140 degrees, and the coronoid process enlarges and projects above the level of condyle. Coming to the 9th question. Foramen of Vesalius is foramen sphenoidal, foramen rotundum, foramen lacerum, or foramen spinosum. The answer is A. Sometimes there is emissary sphenoidal foramen or foramen of Vesalius. It is situated between foramen ovale and the scaphoid fossa. Internally, it opens between foramen ovale and foramen rotundum. Coming to the next question. Question number 10. When a patient attempts protrusion, the mandible deviates markedly to the left. Which of the following muscles is unable to contract? A. Left temporalis, B. Right temporalis, C. Right medial pterygoid, or D. Left lateral pterygoid. The answer is D. The right lateral pterygoid and the right medial muscles, they turn the chin to the left side as part of grinding movements. When right lateral pterygoid muscle fails to contract, the mandible is pulled to the right and vice versa for the left. That's all. Thank you all and happy studying.